In this video, I just want to introduce volumetrics, which is a method for measuring edema in a limb. Volumetrics is probably the most valid and most reliable way of measuring edema in a limb, and therefore it is the preferred way to do it. It does, however, take a little bit of setup and a little bit of time. In this video, I'm just going to introduce you to the procedure. I'm not going to go through all of the details. The details you can find in your readings. But what I want to do with this is just give you a visual to provide some context for those readings, and then you can gather the details from the readings as well. We will also go through this procedure in class. So what we have here is a device called a volumeter, which is basically a big plastic box. Down here it has a bar that goes from one side to the other side as a volumeter, and then it has a little spout here. We also have just a container for catching the water out of the volumeter, and then we also have a graduated cylinder that is marked in, I believe, 5 millimeter increments. So what we're going to do is we're going to have our patient put their hand in here to displace the water that their hand and forearm will then be taking up. And by measuring that water that is displaced, we can measure the volume of their hand, wrist, and distal forearm. When you're doing this, you want to make sure that you do it the same way for both arms. I'm just going to show you one arm right now. Part of doing it the same way for both arms is to make sure that all of your tools are already wet, that they've had water in them, and they all have had water in them. This one had a little extra, actually. There's only a few drops of water left in here when you pour it out, but those few drops of water will alter your measurement ever so slightly versus doing it with this dry. So the container that you are going to catch the water in is placed under the spout. Then you want to bring the water level in your volumeter up to the point where it is draining. So I'm going to pour some water in there from my graduated cylinder. Hopefully I have enough. There we go. Just to where it's draining into my container. And you're going to let that drain until it stops dripping. All right. So it's draining. It's still draining pretty good. It's dripping a little bit. You don't have to wait till it totally stops dripping. That would take far too long, and especially when you do this again with the patient's arm in it. If you're waiting there for 2 minutes for it to totally stop dripping, your patient is inevitably moving and altering the measurement at that point. So we've stopped dripping pretty good here. Now I'm just going to take these and empty them out quickly. In there. I'll just put that in a towel. I do have a towel underneath here. That's just to gather or to catch any spills that may occur. I'm going to place my container again under the spout here, and I have my graduated cylinder, which I'm going to put off to the side. Now what I would like you to do is I would like you to take your right hand with your palm facing you, and you're going to put it down in the cylinder so that your thumb is pointing at the spout, or is on the spout side of the volumeter. I also want you to move your middle and ring fingers slightly apart, because that bar that's down in there is going to go right between those. When you go there, I want you to push on that, fairly firmly. It doesn't have to be really hard, but firm. And then the other thing you want to make sure that you do is once you're in there, you don't move at all, and you keep your wrist perfectly straight. Okay. All right. So let's go ahead, have you put your hand in there, put it in fairly slowly so we don't spill. There we go. Very good. Our container just gathers that water up. And you can go ahead and move down in there, all the way down, and then some fairly firm pressure on that bar. Very good. Make sure I'm gathering all the water up there. Okay. And now, still dripping a little bit. Try to stay perfectly still. Alright, now that our dripping has stopped, I'm going to have you come on out of there, just pull it out. All right, I'm going to give you this towel so that you can dry yourself off. And then we're going to take our graduated cylinder and pour this water into the graduated cylinder. Now this container also has measurements on it, and it's important to kind of take a look at that and eyeball about where they're at. Because the graduated cylinder only goes up to 500 milliliters. If they're more than 500 milliliters, you're going to have to fill this twice. However, this will not measure anything under 50 milliliters. So if they're between 500 and 550, you're going to have to fill it up something short of 500 and then put the rest in so that you have more than 50 the second time you fill it. But he appears to be slightly below 500 milliliters, maybe around 480. So we're going to just pour this in here into our graduated cylinder. Okay, get all that water out. And then with this on a stable surface, I would normally take this and put it up on a table and let it rest on a table. I don't have one of those here. But it appears to be about 460 milliliters. I can't read it exactly by holding it, but again, placing it on a table so that you can read it would be helpful. When you look at the measurement in the graduated cylinder, you may remember from a chemistry class in the past that the water kind of creeps up the sides. You don't read where that water is creeping up. You don't read the top. You read the bottom of the water as the surface of the water. You don't read where it's creeping up the sides. And that'll become more apparent to you when you are able to take a look at it. We would then repeat the process for the other limb. When you repeat the process for the other limb, of course you have to reverse your setup so that your thumb is still pointing at the spout. You would reverse the setup now going this way and do it again, but just like that. It's important to have your patient's position the same every single time. That's why I really like to do it in sitting and have my patient lean down. That way I know their body is at the same height, the angle that they go into the water, and all of that is consistent from time to time. You could do it on a tabletop with your patient standing, but then I would do it that way with both arms, and I would document that it was done that way. So that's the volumetric method of measuring edema, or introduction to it. And again, there's more details on the how to do it in your readings, and we'll go over it again in class.